Hi, Dr. Becky here. In a previous video, I talked about working with stressors. And for this video, I want to talk about the stress response. Before I jump into that, I want to talk about the stance that you'll notice in this video and throughout all the videos that we'll be doing together. And that is that I'll be asking you to take an objective stance. And that is when you look at your life and your situations, that you view them as objectively as you can with an attitude of kindness and compassion. Now, this isn't the kind of stance most of us take with our life. It's a little bit different, but the research strongly supports how this can be helpful. So I encourage you to look objectively and with kindness and compassion, and this will allow you the best opportunity to learn from your experiences and also to gain wisdom in how to approach your particular stressors and stress response. We all know what it's like to experience stress, but you may not know that stress is manifested in 4 different aspects, and you'll see those listed over here. And that is in the emotional, behavioral, cognitive, and physical realms. Understanding this can help us to gain a better understanding of our own stress response in each of these areas, and also help us to begin to think about tailoring for ourselves the techniques that we'll be talking about in the future to help our particular situation. So first of all, emotionally, stress tends to show up most in terms of frustration, anger, fear, anxiety, sadness. These are neither good nor bad. They can show up as very mild or totally overwhelming. Emotions change throughout the day. And you might find for yourself that your emotions tend to be closer to the surface, and that is that you might react a lot quicker than you used to do because of the overall stressor that we're experiencing with the coronavirus. Now, behaviorally, we all try to do things that help our stress, and some of those things help. But sometimes the things we try to do can actually make our stress last longer or make it worse. And some of those things tend to be actions like withdrawing from others, eating more, drinking more, or acting impulsively. These less effective strategies or actions are what we would call the behavioral aspect of the stress response. Cognitively, stress affects us in multiple ways. One of those is that when you're stressed, you probably find yourself having a hard time concentrating. Now, this might mean that you're overly focused and narrowly focused and can't see the big picture, or it may be that you're so scattered that you can't concentrate at all or focus. The cognitive area also includes our thoughts or our self-talk. When we're more stressed, our self-talk tends to be more negative towards ourselves, towards others, towards our situation. Worry is another aspect of the cognitive area. Those of us who are wired for worry are certainly going to see an increase in worry when we're more stressed. And even for those of you who don't tend to worry, you may find yourself worrying in the current context of the coronavirus. Now, physically, you've probably all heard of the fight or flight syndrome, and that is that the body can gear up to take care of situations that are truly life-threatening. There's a whole complex of things that occur within the body, and this involves biochemical, hormonal, and electrical responses to allow the body to gear up to fight if needed or to flee if needed. The brain recognizes danger faster than we might consciously. The body recognizes danger and reacts. Now, this might manifest itself in an increase in adrenaline, an increase in muscle tension and tightness, an increase in heart rate, faster breathing, more shallow breathing, and there are others, of course. This might show up in our own life in things like increased headaches, increased gut aches, insomnia. Now, of course, stress is not the only reason we have these symptoms or these conditions, but for all of us, when we're stressed, we do have some degree of the fight or flight syndrome occurring within our body, and we call this the physical response to stress. Now, one of the things that's important to know is that we're all unique. We all experience stress in these areas, but we're unique in how that looks on us. You might notice friends and family, even somebody on TV who is reacting differently than you are. It would be easy then to judge yourself or to judge someone else. And my suggestion is not to compare and certainly not to judge. So these are just a few of the ideas about the stress response, and hopefully it will be a beginning discussion, and we'll use this idea of these 4 aspects as we move forward. My suggestion for you in terms of an action point from this video is to maybe think about keeping a diary of what you notice about your responses in these 4 areas. This is not at all to be an opportunity for sadness or for judging yourself, but as an opportunity for gaining wisdom and insight. And we certainly will be using that information as we talk about techniques in the future.